on their communities, and a lot of times the evaluators was going back and doing some follow-up interviewing and discussions with those groups to try to document that impact better. So those are some of the major ways that we, and then of course there was a social networks analysis that really looked at the collaborative relationships that were forming, how much resource sharing was occurring, and that kind of thing.
Thanks, Sarah. We just have a couple minutes left. I wonder if there's any piece of advice or something you would do differently next time, if based on what you've learned from the Ladder to Leadership program experience that you'd want to share with folks on the webinar.
Oh gosh, Lynn, this is Lynn, and I would say the number one thing is I would go back, if we were to do it over again, and rework the curriculum such that the threads on race, power, and privilege were actually more prevalent throughout the curriculum, given what we learned first time around. In fact, with the Executive Nurse Fellows program that you mentioned that RWJ does and with CCL, because of what we learned from Ladder to Leadership, when we rebuilt the Executive Nurse Fellows curriculum, we have a thread in that program on race, power, and privilege to help people that are leading at that senior level in these health systems that these executive nurses lead, from academic systems to clinical institutions, understand the platform they have to affect systemic level change on issues of race, power, and privilege in health and healthcare. And so that was a huge learning for us, that how critical it is in the work in health to include skill building around those particular issues. So that's the primary thing that comes to mind around what we would change.
This is Sally. I think the thing that I would add is in our future work with the Center for Creative Leadership, we focus more on training folks in teams